Hi there, my name's Robert. I'll be doing your exam today. For all of you watching, this is my head-to-toe assessment for Nursing 612 at Maryville University. This is Cole. He's my volunteer today for this exam. So prior to doing this exam, we did Cole's height and weight. We did his vital signs. We got him dressed in a gown, and he emptied his bladder. So to start off this exam, we're going to first be looking at his head and face. Basically what we're checking for here is any obvious skin lesions, deformities, any lumps or bumps that we see, any signs of bruising or trauma, which none of that is noted, which looks good. So moving on from that, we're going to go ahead and palpate around. So as we're palpating around the skull, we're checking again for no lumps or bumps, no indentations, no signs of tenderness. We're looking at his hair, although it's very short, and it's evenly distributed and not falling out. Feeling around the back of his neck, down his head, and his scalp moves freely over his skull. We'll go ahead and palpate over his sinuses, so make sure there's no tenderness or obvious swelling there, both under his eyes, below his eyes, and there's no tenderness noted there, so that's good. Pretty much everything is coming out normal so far. As we do that, we're going to go ahead and move on from the head and start into the eyes and checking some of the cranial nerves. So what I'm going to have you do, Cole, is a couple things for me. First off, if you could give me a big smile. Good. And clench your teeth. Good. Go ahead and I'm going to check and make sure that your temporomandibular joint is good. So move your jaw up and down, side to side. Good. No clicking or cracking noted there. Free moving. So that's good. Okay, go ahead and puff out your cheeks for me. And stick out your tongue. Good. Good. Wrinkle your forehead. Perfect. Okay, so there we were testing his cranial nerve 7. We were also checking to make sure that his mandibular joint is free moving and all that, which we did. I'm going to go ahead and do a sensation and test cranial nerve 5. So Cole, what I'm going to do here is, I'm going to sit on the bed with you. I'm going to have this Q-tip that's sharp on one side, dull on the other. As I go along, I just want you to tell me if I'm doing sharp or dull and how it feels, okay?
Sharp, dull, sharp, dull, 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 sharp, sharp.
Good. So he's got good sensation across his face, no problems there. So cranial nerve 5 is intact, which is wonderful. We're going to go ahead and move on into his eyes. So looking at his eyes, we're checking to make sure there's no scleral conjunctiva hemorrhage or discoloration that can indicate perhaps like a liver problem if you were jaundiced or any trauma or infection, which they are white around the conjunctiva, sclera, all looks good. He's got good equal pupils, he's able to move his eyes freely, there's no obvious swelling around either eye, around the orbits. He's got good distribution of both eyelashes and eyebrows. As we palpate around the lacrimal apparatus, there's no tenderness, swelling, or drainage felt or indicated. So all that looks good. I am going to have you do a couple tests here checking for ocular movement. Go ahead and follow my hand for me, Cole. So come over that way, good, up, down, good, over, again, up, down, over. Good. So he has good free ocular movement. He's able to track appropriately. All that's pretty well. I'm going to go ahead and do an cover test. So I'll have you cover your eye there for me and look straight ahead. Okay. And that looks good. And then do the same with this side. And good. You can go ahead and keep. Okay, perfect. Keep focusing on that point. There was no strabismus or extraocular movements that might indicate a problem with his eye or cranial nerves that are affecting his eyes. So far, all looks good there. I'm gonna go ahead and look at his ears now. We're gonna do a couple different things. First thing, we're gonna start by inspecting. As we look at his ears, we're looking for symmetry, make sure that they're even, make sure the tops of the ears are equal, roughly with the eyes. There's no obvious swelling, there's no drainage coming out of the inner ear, there's no lumps, bumps, or erythema noted. As I palpate around the kind of golden auricles of the ear here, I also don't appreciate any tenderness, swelling, or edema. All seems to be well there. I'm going to go ahead and take a look inside the ears, looking at the tympanic membrane. Make sure that all looks good there. So as we do that on an adult patient, we pull the critical of the ear up and back and take a look. He's got a good pearly gray tympanic membrane, no erythema, no tenderness as I pull up and back, noted, and definitely no drainage. Again with this ear, same thing. He's got a good clear tympanic membrane, no erythema noted, minimal cerumen on that side, no tenderness or drainage. So that is good. We're going to do a test here, Cole, that basically is testing your cranial nerve 8, and it's called the whisper test. So I'm going to kind of step back and whisper, and then I just want you to repeat what I say, okay?
Hospital.
Good. We'll check this side here.
Hospital.
Perfect. Okay. So cranial nerve is intact, which is good. We'll go ahead and check some conductivity, his bone conductivity and bone to air ratio conductivity. So Cole, I'm going to hit this, sit it in the center of your head, and I just want you to tell me if you hear it in one side or the other or both, okay?
Both.
Good. Okay, and we're going to do this again, and I'm going to sit it behind the ear, and then I would like you to tell me when you feel it stop vibrating, and then I'll set it next to your ear, and then tell me when you hear it stop ringing, okay?
Stop vibrating. Stop ringing.
Good. So he's got a good 2-to-1 conductivity there. We'll go ahead and look on this side.
Stop vibrating. Stop ringing.
And again, a good 2-to-1 conductivity there. So that's perfect. Those are normal findings. So moving on, we tested your ears and your eyes here. We'll go ahead and look at your nose, okay? So looking at the nose, we're first looking to inspect to make sure that there's no obvious deviations or deformities. There's no drainage. Nose is midline. Looking in the nose here, we're looking to make sure that the mucosal membrane is pink, no signs of any lesions. Looking posterior, septum is midline, hair, cilia noted. Everything looks perfect there. Okay. What I do need you to do is go ahead and cover one nostril for me and breathe in. Good. And do that on the other side as well, please. Good. And he's got good free air moving in both nares, no signs of congestion or indication that he can't breathe openly through both sides. Now that we go ahead and do that, we'll go ahead and come down and feel his neck. We're first off going to assess not only movement and tenderness, but we're also looking to make sure there's no obvious deformities, bruising, swelling, lumps or bumps, which I don't appreciate any of that on him. He seems to be moving it well. I am going to go ahead and have you pull do a couple of things. I'm going to push my hand here against you, and I want you to move your head side to side and push hard against me, okay? So go ahead and push hard. Good. And go ahead and push hard. Good. Push hard forward. Okay, and push hard backward. Good. Now I'm just going to move your head a little bit here to test some passive motion. So as I'm moving his head around, he has good both active and passive range of motion. There's no crepitus noted as I'm moving his head around and feeling his neck. No tenderness or soreness or complaints of that. He has good even muscle strength in all directions, which is wonderful. So Cole, I'm going to go ahead and do a couple things. I'm going to palpate around your neck here. We're feeling your lymph nodes. So starting in the pre and post auricle. So post auricle here, I'm checking. And your pre-auricle lymph nodes here. No swelling. We'll come down and feel the occipital lymph nodes. Again, no swelling. Coming around and feeling the thyroid lymph nodes. Using 3 fingers. I don't feel any swelling on those. You got the submandibular. And there, the submental. Good. The deep clavicular. Good. The superficial cervical, posterior cervicals, the supraclavicular, the infraclavicular, and we'll check your axillary here. So as we come around, and I don't feel any swelling, lumps or bumps, or any indication that he has swollen lymph nodes there. And just a correction, I might have said deep cervical or deep clavicular. I meant deep cervical and superficial cervicals here. So all looks good there. We're also going to look and make sure that his trachea is good in midline, which it looks to be. No signs of deviation, which would indicate potentially tension pneumothorax or trauma to the trachea or anything like that. We're also going to feel along, make sure it feels good, and then have him swallow, testing the thyroid gland, which does not feel swollen or was an appropriate assessment there. So far all that is well. Go ahead and now we're going to inspect Cole's mouth. Looking at his lips, they are moist, no cracking or dryness, anything like that. Cole, I'm going to have you do a couple things. I'm going to have you open your mouth and stick out your tongue as I look here. Good. Ah. Good. So his tongue's out. Good. Relax. Ah. Good. So uvula is midline. He has a wonderful Mallampati score. No noted tonsils as they have been removed in the past. No redness, erythema, no signs of any drainage or anything like that. Looking at his teeth and the rest of his oral mucosa, I don't appreciate any lesions. No signs of any abscesses. No, his gums look good. No signs of gingivitis. All teeth are accounted for. They're white and intact. No signs of breaking, cracking, or poor hygiene. Cole, could you go ahead and lift your tongue for me? Looking under the tongue, I appreciate good oral mucosa. No lesions or anything that would be a concern for any oral cancer. One last thing I'm going to test is your gag reflex, and I'm sorry for this, but I gotta check and see here, so I'm just going to test and make sure that your gag reflex is. Okay. So testing both sides, his gag reflex or cranial nerve is intact. That's cranial nerve 10 actually. So all is good there. Perfect. Good job, Cole. Moving on down, we already kind of did the neck. We'll go ahead and do the upper extremities. Excuse me. And so what I'm going to have you do is just go ahead and put your arms out for me. Good. He's able to hold them out. Just inspecting both arms. You can relax here. He's got good even muscle distribution, no signs of atrophy or any thing of concern there, no lesions or abrasions, bruises or bumps, no obvious bone deformities. Again, same thing, checking for pulses. He's got good palpable radial pulses. We'll go ahead and check his brachial pulse here. Good palpable radial pulse, or excuse me, brachial pulse. Regular rate and rhythm, I'm not feeling any like any bounding pulses or thrills that would indicate any kind of problem there. Cool, I'm going to test your strength, so if you could make a fist and kind of hold your arms up, perfect. Pull, good, push away, good, give me good squeezes, good. So he's got good equal grips and strength in both arms. He's able to move freely, no obvious lesions or deformities, good grips, good pulses there. So that's very good. Cole, could you go ahead and sit up for me? We'll go ahead and look at a couple different things here. We're looking at his spine, both the cervical, well, not both, we're looking at the whole spine. So cervical all the way down to the lower lumbar and sacral spine, making sure everything is midline, there's no obvious deformities, tenderness, no bruising, or anything there. So as I palpate along, Cole, is there any tenderness at all?
No.
So there's no tenderness noted in the cervical spine, no large bumps. His spinal column continues midline on down. No signs of deviations or trauma there. No tenderness noted as we head down into the lumbar spine. Muscle is evenly distributed and skin all looks good. There's no obvious lesions or lumps or dots. Well, I have you sitting forward, Cole. We're going to do a couple things. I'm going to go ahead and listen to your lungs. I'm going to palpate your lungs, kind of do a few different things with here. So starting, first off, I'm going to go ahead and percuss his lungs back here. So just make sure you're starting usually around the second intercostal space and working your way down, making sure that you are in the intercostal space, that way you get that nice resonant sound from the lung. Good. And good. So we got good even resonance, which is a good finding. There's no dullness or anything in the lung, which would indicate some buildup or a tumor or anything like that that would be of concern. What we are going to do too while we're back here is I'm going to check for tactile fremitus. So Cole, when I put my hand, I want you to say 99 every time I go along, okay? Go ahead and start.
99.
Good.
99. 99. 99. 99. 99. 99. 99.
Good. So tactile fremitus intact, which is good. That's what we want to hear. There's good vibration, evenly distributed. Now what we're going to do is check for his diaphragmatic excursion. In order to do this, we just take a marker here and Cole, I'll have you follow my instructions and we'll just do a couple things here, okay?
Mm-hmm.
So go ahead and take a deep breath in for me and hold it, okay? Okay? And breathe out. Take a nice good couple breaths. Good, good. Okay, and then I'm going to have you breathe all the way out this time. All the way out, all the way out, good. Okay. Perfect, go ahead and breathe normal. Okay, so that was a good 3 centimeters there, which is a normal finding. That is saying that your lung is expanding and contracting appropriately, your diaphragm's working, all's good there. Okay, cool. We're going to do the same thing on this side, so if I can get you to breathe normal and then take a deep breath in and hold it. Good. Okay. And then go ahead and breathe out, relax. And then we'll have you do that one more time, but I'll have you exhale and breathe it all out, okay? Good. Here we go. Okay, good. And again, a good 3 centimeters. So there is no abnormalities there. Normal finding, bilaterally symmetrical. All that looks good. And I'm going to go ahead and, since you're sitting up, we'll just do a quick listen to your lungs here. Making sure we do a nice even pattern. So good deep breath in. Good. 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 And good. Both sides are clear, even throughout, no signs of fluid buildup or anything of concern there. Okay, cool. Go ahead and sit back for me. So now that we've looked at the back, everything looks good there. We'll go ahead and look at his chest. So what we're looking for again is symmetry. Make sure there's no signs of trauma, no flail chest, no obvious deformities, muscle atrophy, or anything of concern there. What we're going to go ahead and do is the same sort of thing. We're going to do a little bit of percussing to check the lungs. We're going to feel for any heaves or anything over the heart or thrills or pulsation there. So starting here, I'm going to go ahead and just feel around, make sure that everything feels good. Okay, and then I'm going to go ahead and percuss. Good. Good. And we'll do the same on the side here. Again, we're percussing in between the vertebrae or the okay. And we'll check this side. Let me keep it on me. Good. And we got nice resonant sounds as we do that bilaterally, which is a normal finding for the lung. While we're percussing and palpating, I'm just feeling for any thrills or heaves over both the aortic area and the pulmonic area. And I don't feel any heaves, thrills, or pulsations there, which is good. While we're also palpating, I'm going to go ahead and feel for the apical pulse, which would be around the 5th intercostal space, mid-clavicular line. Which is very palpable there, which is a good finding. So moving on, we'll go ahead and take a listen, and both at the heart and lungs as we do this. So starting with the lungs. Good. Good. Okay, and then that was the lungs, so now we'll go ahead and do the heart here. Starting with the aortic here. on it. Herb's point. Tricuspid. And mitral. Good. And all that's normal. There's no signs of any murmurs or abnormalities. Rate and rhythm are both normal with that, which is a good normal finding. So moving on from the heart and lungs, we will come down to the abdomen. First, we're going to start by inspecting. The abdomen has even distribution. Everything looks good there. No obvious deformities or anything. As we, before we get to percussing or palpating, we'll auscultate, make sure everything sounds good. And everything sounds good there. So we'll do a light palpation, percussion. Just checking. You should hear some resonant, hyper-resonant sounds when you're over the hollow organs, and then you may hear some more dullness when you're over the solid organs like the liver. We'll do a little bit of a light palpation. And you're appreciating any tenderness, soreness, or obvious lumps or bumps with that. At this time, we'll do some deep palpation where we're trying to see if we could feel basically the spleen and the liver borders. So Cole, go ahead and take a deep breath in and then out. Good. Okay. And then again on this side. Whoa. Let me come to this side, make it a little easier to feel. So I was unable to feel the spleen very well. It is deep under there. You can feel the border, but that's about it, which is a normal finding. The spleen is, if it's not enlarged, is normally difficult to get to. The liver, you can feel the border. It all feels normal there. As we percuss down, we'll check for the size of the liver. So we'll go ahead and come up the abdomen here. Start there, and then we'll come down and you're listening for a change from the resonance in the liver there. And that should be about 7 centimeters, which is a normal finding. And that's exactly 7, so that's a normal finding, that's good. So looking at his abdomen, everything looks good. As I was listening for his aorta and his both renal arteries. I'm also going to go ahead and listen for his femoral arteries. And all that's normal, rate, rhythm, you can auscultate all those sounds. Lastly, we'll check his legs. Cole, go ahead and sit over to the side for me here. Looking at his legs, we're just going to test strength. So I'm going to have him kick out against me here, push against. Okay, push against, good. Pull, and pull, good. I'm going to go ahead and test his reflexes. Good. And his Achilles. Good. Achilles again. And his knee. Good. I'm also going to test his brachial. So, good. And brachial. Okay. So good reflexes. I'm looking for even muscle distribution and hair distribution on his legs. There's no sign of any peripheral vascular disease. He has good palpable pulses bilaterally. Pedal pulses are wonderful. Good popliteal pulses bilaterally. And all looks good there. So for today, that pretty much concludes us. There's one more thing I'm going to check on your core. I just want to make sure there's no tenderness. As I felt around back here in your back, I just want to make sure there's no costal-vertebral tenderness. So I'm just going to, and there was no tenderness for this costal-vertebral angles. Again, at this time, this concludes our physical exam for today. Thank you.